living in a joint family is of course a blessing.
How do you manage, how do you juggle all this?
I feel that nothing is impossible. Everything is possible if you really look at it.
I read somewhere in one of your interviews, you had said that nobody should be turned away.
And I think it's in my genes. I always ask our students also. And I love myself. I'm myself passionate about science.
Girls usually go for medicine and boys usually go for engineering.
Because generation keep on changing, expectations keep on changing, and we have to gear up ourselves to their expectations.
Either get into an engineering or you get into medicine.
I would say it began with my father-in-law. Since childhood, that has been motivating me.
What would your advice be to somebody who doesn't get into an MBBS?
It's a study. It's a study. First, you have to go through all the regulations before you start something.
Cut out to be a doctor right from the start.
As doctors, we can't sit at home. I feel that there is a lot of potential and need of the hour.
I'm talking the medical city, the health city as such.
This is not the time to ask something like that.
Welcome to Conversations. I'm Suresh Kochatal. When you speak to women, usually they are not in leadership roles. They may be in motivational roles, or they may be homemakers, or of course, they may be even prime ministers. But somebody straddling a business world is very few and few in between. I can think of Kiran Majumdar-Shaw of Biocon and Sudha Murthy of Infosys in a different context, and others who are there as a part of the business world. But then in Hyderabad, it's difficult to find somebody who straddles all this. And I have with me one such personality today, Dr.Preethi Reddy. Namaskar.
Namaste, sir. Namaste.
Person, how do I introduce you? As a Vice Chairman of the Mallareddy Health City, Mallareddy Group of Medical Institutions that straddles from dental to the hospital. And of course, as the Director of the Mallareddy Institution, which includes engineering and other disciplines, a whole lot of stuff.
Yes.
Including the Mallareddy University that is now there.
Yes, and also the hospitals, what we run, the healthcare system too.
So in all, we will take you through a journey that starts from your early days. Naturally, the first question which I ask in this conversation is, where were you born?
I'm born in Pune. I'm born and brought up in Pune. Actually, I belong to Karnataka. My parents hail from North Karnataka, and they have settled in Pune, and I'm born there, brought up there. My education, everything is in Pune. Yes.
So that's a beautiful city, Pune.
Yes,
and today it's one of the most industrialized. I remember Pimpri-Chinchwad and all those areas where I've traveled extensively.
I think Pimpri-Chinchwad is the place where I was born. Yes,
wonderful.
That's the right place. Yes.
Okay. Now, when we say you belong to Karnataka and then, of course, you traversed through your marriage and all to Hyderabad. But when you look at your journey as a young kid, usually in those days at least, people would say, okay, there are two disciplines where you either get into an engineering or you get into medicine. Girls usually go for medicine and boys usually go for engineering. And now, of course, the scenario has totally changed. But were you cut out to be a doctor right from the start?
Yes, of course. I was inclined towards being a doctor because my father himself was a doctor. He's completed his MBBS and then later on he did his DPH, and he was a Chief Medical Health Officer of Pimpri-Chinchwad Corporation, Dr. Nagakumar. Okay. And moreover, he was himself into administration. I think since childhood that has been motivating me. And my mother was an MSc microbiologist, and she was working as a scientist in National Chemical Laboratory. Now they are no more. But I would love to carry on the legacy of administrator, and I think it's in my genes, being a doctor and an administrator too.
So when you say your parents had a great influence on you, naturally all of us remember how they stood, the principles which they stood for, what they taught you during the youngs. Any siblings?
No, I'm the only child.
So you must have been pampered.
Yes, but then actually, unfortunately, after I was born, my mother suffered from pulmonary embolism, which is one of a postpartum complications which might happen to any woman who has just delivered. And then for 14 years she suffered with this pulmonary embolism. Was a very the home the entire house atmosphere was always used to be a critical mode. But even in that mode, what I used to see in my parents is the positivity, their attitude to to try to keep a normal life for me, and try to give me whatever I asked for, not in just in terms of things, but giving that normal atmosphere. In spite of she having a pulmonary embolism, she was taking care about my studies. She used to literally take care of me. She used to make me feed and everything. And she used to be like on oxygen for 1 to 2 hours and 1 to 2 hours off the oxygen. So it was a lot of hardship, but I'm so proud of them. They have raised me without me getting into that concern of, there is some trouble going on in the house.
That must have been one of the motivating factors for you to become a doctor.
Yes, of course. That was one of the motivating factors. And the whole thing, I mean, the atmosphere around me, because of my father and my mother, was absolutely, as they come from a very strong educational background, they always motivated me to do whatever I want to. Like, they would never ask me, you have to become a doctor. Nothing. They said, what do you want to be? I said, this is what I want to be, because I've seen you guys doing the same, and I love myself. I'm myself passionate about science. So I think, I always ask our students also, or anyone who is also listening to this, I feel that it is important to choose what is you're passionate about, because that will take you to in a long run. And that will always keep you motivated and keep you happy in whatever you're doing.
So love what you love to do.
Yes.
Okay. Medicine. Where did you do your medicine from? What was your early days of medicine like?
Yes.
And what did you specialize in?
I've done my MBBS, and I've later done my MD in internal medicine in D.Y. Patil. And after that, yes, of course, I found my soulmate there, Dr. Bhadra, and we both have completed MD medicine in D.Y. Patil. And then I got married, and I'm here.
So when you came to Hyderabad, I don't say it's a culture shock, but obviously there's a difference between being a Karnataka girl who grew up there and then coming to a city like Hyderabad, which now, of course, is totally changed. I'm talking of the early days when you would have been here. Getting married into a family like this, and suddenly from, I guess, what would be a middle-class background,
Yes.
being now suddenly pitchforked into more of a business family.
Yes.
How was the transition?
Basically, sir, I would really appreciate this part of, my family at the moment, the Chamugora family, that is Sri Mallareddy Garu and the family. They are extremely normal. They are extremely down to earth. The shift from my family to this family was almost the same. In fact, I would say that my mother-in-law made me so comfortable. Even I didn't know the language. She took that thing or that interest to teach me Telugu, and I also learned it through her, and there are other family members in and around me. They supported me so well, and most importantly, of course, my father-in-law, I would say that I found another father in this house I'm not saying because I'm on the screen. I would like to say it in anywhere, any corner of the world, any given point of time, because I know how they treat me. I'm happy, I'm content, even if I don't have parents. Of course, I miss my parents. No one on this earth can do that. But they have done their best to take that role, and they take care of me. Even both my kids were born here in Hyderabad. My father was alive even 6 years back. He was alive. I just lost him 6 years before. But even then, the way my mother-in-law handled my delivery, and both my sons were born here, I was absolutely comfortable.
So, ಚೆನ್ನಾಗಿದ್ರ they won't ask you ಊಟ ಮಾಡಿದ್ರ
ಇಲ್ಲ ಅವರು
ಇದು ಭಾವನಾರ
ಇಲ್ಲ ಚೆನ್ನಾಗಿದ್ದೀರಾ exactly ಚೆನ್ನಾಗಿದ್ದಾರೆ is ಭಾವನಾರ in Kannada.
Now when you say medicine, and naturally did you ever get to practice, or you directly got pitchforked into administration?
Sir, after I completed my MD in internal medicine, we got married, I think, within the next 2 to 3 months. So by the time, it was October, I got married, and then we joined, we took a break for around 10 to 15 days post-marriage, and then understand the whole situation, the family, all the relatives, because I think it's very important for any woman to enter into a new family. I should first think what they have to realize is, this is my family. That belongingness has to be there. You have to accept that, yes, she's your mother-in-law, she can be your mother too, and then you have your whole family. You should have that concern, that respect, that love towards them. You have to achieve their respect also, their love also. So it's a journey. I think every woman goes through this transition, but I think living in a joint family is, of course, a blessing, because you'll learn a lot. Of course, there will be restrictions, but you should like people who are ready to accept it. Nothing wrong in it, I would say. And then after that, me and Dr. Badra, we joined CARE in Banjara Hills and CARE hospitals, and we worked there as registrars, senior residents or senior registrars, I remember. And we worked there for 10 months. Dr. Badra was in emergency department and I was in the general medicine department. So it was a nice experience because I think as doctors we can't sit at home. So we had this clinical experience for around a year, I think 10 months or 11 months, yes. And after that we were back. Mallareddy sir was like, his dream was to start up a medical college, and then we began on that journey of starting a medical college.
So before that, getting into the medical part of it, I would ask you about your kids. What do they do now?
Oh, my elder one is just completed 13 years, and my younger one is 8-year-old, and they are fabulous, as every mother will say.
So they were what you would say born with the proverbial silver spoon in their mouth. But have you I'm sure as a mother you would have told them to be grounded. I'm sure I don't need to ask you that question.
Actually, it comes from above. Like I think from their grandparents, that is whether like they have just seen my father.
That's true.
And then even my father-in-law and the family are so grounded that they are it's in their genes that they are very down to earth. I mean, it's not about down to earth. I mean, at this point of, like at this age, I would not say down to earth, but they know, like, this is what we have, and this is what we should be happy in, and this is not the time to ask something like that. They know their boundaries. Their boundaries are set well. So
I remember the early days. I mean, I was in media all that time. I think I was in Times of India when the Mallareddy Group started setting up the first of its type. First was, of course, the engineering part of it.
Yes.
Medicine came much later. How, of course, Narayana got involved, and I'm sure there's a Karnataka connection in that.
Yeah, no, that was before my marriage. Actually, in 2007, when Shri Devi Prasad Shetty sir, he actually took over. It's on a lease. That Mallareddy Narayana Hospital was taken care by Narayana Vridayalaya then, and they took over. They took the entire building on lease. So lease was for 10 years, and then in 2016 they handed over to us, and that was before I entered into the family, and they were running the hospital. I think at that point of time, this area of Suraram was a barren land, and there were very few commercial buildings, and the population was not much. So now it's a city, and I would say it began with my father-in-law, and with the support of course, like Narayana Vridayalaya, it grew into a different hub.
So when you took over, when you got into managing the medical college, I'm talking the medical city, the health city as such. You have dental colleges, you have other institutions also. Can you just talk us through a bit of that?
Yes, of course, sir. I think as I told you, after completing our so-called work at care hospitals, and after completing 10 months of experience there, then we sat upon how to start a medical college, which was my father-in-law's dream. And then we started from the scratch. There was a civil block available, which was there in the Suraram premises itself, and that we had to mold according to the MCI regulations then. And then it was just like it's a study. First you have to go through all the regulations before you start something. And then we started, making every room according to the requirements of the MCI. And then eventually, of course, as the course is written, you need to first have the NOC, or it's also called as the essentiality certificate. At that point of time, it was Kiran Kumar Reddy garu from Congress itself, and even then, we stood strong, and they all we went through all the formalities, all the inspections, and we were being given the essentiality certificate from the state government then. And then we also got the consent of affiliation from that time, Telangana and Andhra was the same. So from the university. And then we applied to the MCI, then we got the LOI, and in 2012 we got the LOP, and the first batch started in 2012.
You're talking of something like 12 years, 13 years now?
Yes, sir, 2012. So
Yeah,
it's
you're
almost
25
13
now.
years. Yes.
Kiran Kumar Reddy, in fact, was my classmate. We
Yes,
studied
yes,
together
yes.
in the
And I totally
intermediate.
thank him because he, in spite of being in whatever, he was a CM then. I will not talk about any political party here, but he was, he supported the institutions. He see to it that more medical colleges should come into the state, and thank you for his blessings. Yeah.
So now that in the initial days, there was a huge shortage of medical seats.
Yes.
Yeah, cracking NEET is as tough as cracking CAT or even JE for that matter.
Yes, yes.
But over the last decade, at least, we have seen a number of medical colleges going up.
Yes,
especially in
yes.
states like Uttar Pradesh, for example, even in Telangana for that matter. Today, when an aspiring student is preparing for a NEET exam, I know it's like 1 in a million cracking that NEET exam. What would your advice be to somebody who doesn't get into an MBBS? I'm not talking of the ones who get in, there's no issue. But one who
I
don't
know
get
what you're talking about. Actually, sir, it's a dream of every student to be a doctor or be an engineer. But now, this all dream is then. Now 5 years down the line, I understand. But now there are so many options available. If you are not able to pass the NEET examination, you have so many other fields where you can explore. So I think that they shouldn't get demotivated. They should try to go for BDS is one. Second thing is they can go for any BSc courses in life sciences, and that will lead to so many MSc courses in different areas. Like I would say, forensic sciences, BSc or MSc in forensic sciences and toxicology, molecular biology, post BSc, or even nowadays, like we have recently started BSc in molecular medicine and stem cell biology. So like that, there are so many courses, whether it is geriatric science or whether it is diabetic science. BScs in all these areas are equally important. And I would say something like now there are places where they have recently started BSc in cosmetology and dermatology. Okay. So these all areas, even if they are not doctors, or they might eventually be doctors after they do PhD in that, but I feel that there is a lot of potential and need of the hour. And most importantly, I would say the technical part, the allied group. Till today, I think people who are unable to get medicine, they either go to dental, then pharmacy, or they go to nursing. This is the usual course. But now let us concentrate on allied group of health professionals, where the technical support, like any surgeon needs or any physician needs, is equally important. Nobody is above or below each other. Everyone plays their own role. As we see in a family, the father has his own role, the brother has his own. In the same way, even in institute or in any hospital, if the consultant is trying to treat the patient, the technician or these allied professionals, I would say, not technicians, they support them to get well soon. Or investigate them well. If they investigate them well, then their diagnosis will be early and they will be treated early. So it's a teamwork, right? So allied health sciences, I would like to say, emergency and critical care, BSc or MSc in it, or else cardiovascular technology. Again, I'm talking about BSc and MSc courses. And the similar way, like anesthesia and then radiology, and then now recently in our Mallareddy Vidyapeeth, which we recently got the status of deemed university, we are concentrating upon the allied health professionals. So we have started a school of allied and public health and technology. So I think we have to integrate technology in each and every field. That's the need of the hour, and that's what is going to happen. As we all hear about artificial intelligence, digitalization and everything. I feel that this is very important, that all the graduates today should have this interdisciplinary knowledge of technology as well as the basic sciences or any science which they would like to choose. Because eventually, if you see, even the healthcare system is getting into artificial intelligence, and the doctors who are at the moment struggling hard to understand the technology part of it, they are well versed with MBBS or MS or MD and all that. But technology is what has to be upgraded. This is what I feel.
You talked about the importance of artificial intelligence, and other day we saw President Trump with the Stargate project, which is with huge 500 billion investment with Oracle and OpenAI and SoftBank. There are many more such things coming up. And you rightly describe the support system. Then an army doesn't go to war like that. The infantry has to have a support mechanism.
Yes.
The army walks on its
Yes.
stomach, as they say.
Yes.
And you need the AOC, you need the EME, you need everything to support the entire thing to go to war. When you look at a medical college as such, and now that you're deep into managing it, you meet different kind of people, you meet different kind of situations. On one hand, I remember, because I worked for 10 years in Apollo, and I know how things in a medical college is, or medical institution is.
Yes.
It must be tough to manage one, people, second, patients, and third, of course, your staff, and then fourth, of course, your the overall ecosystem, that the patients who come into the hospital. How do you manage, how do you juggle all this?
Sir, I feel like, women usually have this capacity to maintain multiple or to do multiple things at a time. Not only just women, I think even men do have it. I have no discrimination over here. But I feel that nothing is impossible. Like, everything is possible if you really look at it, you plan for it, you thrive for it, you have a passion about it. I think everything is possible. I think, and most importantly, my father-in-law, he's a tremendous support to all of us, because everyone thinks about, the financial aspect of it whenever you want to start any business, it may be ever. Sure. So if you have a support system like Mallareddy ji, everything becomes very easy, because he's a dynamic person. I shouldn't tell about him. So he's well planned, well organized. He knows where to invest, where not to invest. He's a far-sighted person. So under his guidance, it was easy for us to build what it is, and easy to build, difficult to maintain, and also to keep up to the expectations of the students all the time. Like I feel like 13 years back when we started, the expectations were different. Now the expectations of infrastructure is different. Even the norms keep on changing. So we need to update ourselves with the present scenario, what the students like. We have to make the entire campus student friendly. The atmosphere should be lively, and the students should love being in the campus at the end. So what we see to it, that we need to give them the modern, the young infrastructure, what they need. Why only the IT people or this thing, they always think about those typical hi-fi infrastructure should be also given to medical college, which we are trying to do that, and we have almost done to a certain level. We have to but upgrade more. I will never say that we have achieved. I will always say we are achieving. Because generation keep on changing, expectations keep on changing, and we have to gear up ourselves to their expectations. Secondly, availability of the faculty. From day one, my forte was to bring the best faculty. When I say best faculty, I mean the dedicated, the experienced, and the qualified faculty. And to maintain them, it's of course, it's not a tough thing. It's possible, but yes, we need to respect them. We need to salarize them well. We have to give them the proper amenities, the freedom of work, the atmosphere from the management side, the freedom of work. Everything has to be provided to our faculty, so that they enjoy their, the way students enjoy their course of studies. This faculty also should enjoy their years of experience or their teaching profession. And then to support them, we need to provide them good nurses, technicians, and administrators. So it's a whole team. I won't say it's just me or my husband. It's the entire team. Our deans are the best. The medical superintendents are doing their job. Recently, our Chancellor, Dr. Sudharamana ma'am, she's the first we appointed in the health, when we started our medical college. So she was the first dean. So I look upon all of them, and they're still with me. The best part is I feel so fortunate that the faculty who joined from day one, they're still with us. Even after attaining 70 years or supernation, they're still with us. And I feel age is just, it's a number. And even after that, they continue to give their services at their best. So, you are right about faculty, because one of the biggest shortages, you are a medical student, you are a medical student yourself, you know how important the faculty is. Yes.
And especially when you get into super specializations.
Yes.
MBBS is just a vanilla course. It's no good to just have an MBA.
Sir, I would like to tell you this upon it. Having the good people, we first as a management have to create that environment to them.
True.
We want to invite the best faculty, okay, but if the management doesn't give them the proper environment, then like whether it is a clinical material, whether it is the equipment or whether it is the freedom of teaching or experimenting their own ideas, their own views. If you don't give them all this, I don't think so you can get a good faculty. It's the management support as well as the faculty itself. They are very good. They are in need of such a place where they can explore themselves. They love teaching. They want to do a better surgery, but you have to create that environment for them.
In fact, when you say Vishwavidyapeeth, that's a different concept.
Yes,
Actually,
yes.
it's not just a college. But I read somewhere in one of your interviews, you had said that nobody should be turned away for a lack of good health care.
Yes.
I mean, everybody should get it no matter if they can afford it or not.
Of course.
Can you, I know healthcare costs money. It is not that somebody can just give it away free.
Yes,
but
true.
There must be moments where you are caught in a dilemma.
I'll tell you this, sir. Fortunately, when we started, we planned to start a medical college, the most important aspect of the medical college is the teaching hospital. The availability of the clinical material to the MBBS students is equally important, unlike the other fields, I would say, because for them having a college building and with full of equipment, say for example engineering, it's kind of a static place where I think hospital is not required, and it's just the building with the equipment is enough. But whereas when it comes to MBBS, especially MBBS and BDS, a teaching hospital, a full-fledged, well-established teaching hospital is very important. NMC has their own norms, like the number of beds required for each and every number of seats. It's very clear. And most importantly, the OPD. So the number of cases, the outpatient, we have almost more than 1200 OPD or even sometimes 1500, depending upon this thing. But overall, on an average, we have around 1200 to 1400 patients coming every day to each teaching hospital, and the other teachers. So we are running 2 teaching hospitals because we are having 2 medical colleges and 2 dental colleges, and as per the norms, we must have a teaching hospital for each. And this teaching hospital, you need to have the said number of OPD or IPD or bed occupancy or surgeries, because you have to give a practical exposure to our students.
That's how students learn.
Exactly. So this mandates us to run the hospital absolutely free of cost, which we are doing it since last 15 years. The OP is free, the IPD is free, the surgeries are free, the investigations are free, except for the consumables. If there is an operation theatre, like any implants or any consumables, the drugs, the pharmacy, except for that, everything is free of cost. And of course, the deliveries, whether it's a normal or a cesarean, even that is free of cost. In fact, we give something called as Mallareddy kit. For a female born child, we provide the basic necessities as well as 5,000 rupees DD to a female born child. And for the male born child, we give 2,500 as an amount for DD and with the basic necessities. So as we know that KCR kit was there then, so they used to give 12,000, but anyways, the government can give, but as a private, we have to maintain the number. Before the KCR kit had come, I remember the number of deliveries we had were far ahead. We used to cross more than 200 deliveries per month. But after the comments of the KCR kit, I think everyone opted the government hospitals. But even that is getting flooded. So people are coming to private institutions like us, the teaching hospital, where they have been treated well. And the availability of so many doctors. Everything goes hand in hand. When you have so much of OPD, you have to also have so many doctors. So NMC requires there's a big list of doctors which is required for each and every department to run UG and PG. So we have everyone working as a full-timer in our campus, in our hospital. So that makes it successful.
Any plans to move to other geographies?
No, not yet. Not yet. We are happy being here. In fact, we want to make it as a hub of education, not only in medical, in dental, but anything is possible.
So that brings me to the other role which you have as the director of the other institutions. And you really spoke about AI and medicine.
Yes.
And surely there is a marrying of forces now. You can bring the engineering students to a real world environment.
Now it's all open. I think the BPC and MPC students can opt any of the
You can
fields.
come in and learn all this. Even engineering students, instead of doing the normal engineering, can start thinking, why not I do something on the, not just build a medical device by itself.
Exactly.
Or build a doctor appointment system.
No, I'll tell you, sir, what happens is, in engineering, they're usually they're taught about the engineering aspect of everything. when they want to apply this in the healthcare system, they don't have the basic science exposure of the medical sciences. That's where they need, they lack. And then they need these kind of institutions where they can come, they can get trained, either they can do MSCs or they can do fellowships, and they can expose themselves to the healthcare part of the system. I would not like to name them, but recently I met a team. They had created this AR and VR application for anatomical education of heart or anything. It is usually for the MBBS students to make them understand the overall anatomy, because in dissection body nowadays cadavers availability is less, so the dissection is also a little difficult. Anyways, we are able to get them though, and the 360-degree angle, how the heart looks from all over is, or not even that, there are few anatomically difficult places where we can't reach via dissection, so we need to see them. So the AR and VR makes it possible to understand the anatomy much easily than the old conventional method. So he got an AR VR to me, and he showed me that, ma'am, this is the anatomy of the heart, this is the anatomy of the liver, and lungs, every organs, very well explained. I was like, sir, how did you think? Ma'am, it was very difficult. After my BTech, I had to literally sit with a surgeon and an anatomist for 6 months or for 1 year to understand. And then I could make this application. So what I feel is he took that interest to sit with them, and how many faculty would be ready to give their time to them, right? So why not have, and there is no certification to this, there is no qualification which they have to, they have to create such applications. So in fact, if we start something like AR, VR in healthcare system or immersive technology in healthcare system, if we have this BSc or MSc in this, and we can expose the BTech students into these courses, so they will be certified, they would be able to apply it well, and they don't have to go through all this.
So when I ask you, this is a question I usually ask everybody. Suppose you can rewind your life and go back to Pune and say, if given a chance to start all over again, would you do it differently?
Definitely not. But one thing I would like to do, I would like to ask my, I wish my parents were alive. That's the only one thing. If I have to go back, I would say I would like to go back to the day I was born. And or maybe I was not born at all. I would be happy my mother wouldn't have suffered from pulmonary embolism. That would have been my wish. But anyways, my mother was hoping to have a baby, so I will not disappoint her. But yes, of course, so I would like to go and rewind the day I was born, so that my mother wouldn't have suffered from pulmonary embolism and my father would have stayed a longer time, and I would be more happy and more content, and at each and every level. Yes.
Now, coming to the last question, which is very, very obvious, is I come from Kerala, even though I grew up in Hyderabad, where the healthcare systems are excellent, the primary healthcare, which is primarily run by the government. One can't fault institutions like you for it. You already have your OPDs, free OPDs as a part of the teaching college, because you need to have a rural outpost and you need to have an urban outpost in the medical college. But what do you think? The kind of India invests 1.5 to 2.5% of its GDP on healthcare. Do you think a healthcare crisis can drive a family bankrupt literally today? But do you think time has come also that we look at healthcare across the board? I mean, not just talking of your hospital, but as a person who's involved in this sector, where do you think the gaps are?
Sir, I would say that, medicine is a noble profession. So the first priority should be social service, irrespective of whatever you earn from it. Secondly, of course, doctors are also human beings. They have to earn, they have to run their, day-to-day routine and everything, family and all that. And for this, I think it should be balanced. It should be balanced. Like I would say, we drink tea even at normal stalls. We drink tea even at the 5-star hotel. There's a huge gap of, the charges, the cost. But whatever it takes to make a tea is the same. Maybe it is been provided or been
it's the ambience
given the ambience, the way it has been given to you with the cup, the beautiful cup and everything. Anyways, healthcare, yes, of course, differentiates from whether it's from a teaching hospital to a corporate or to a nursing home. There is a difference, but I would say there should be a standardization where we have to fix a certain amount that yes, with all the expenditure, with a minimal margin of profit, this is viable. And that should be comfortable for the patients too. Like in our hospital, Mallareddy, Narayana, we usually have this concept. We have robotic systems, we do renal transplants. And the cost at what we do is, this is what we think. As we are very well blessed with education systems, our corporate hospital purely runs on the basic of ethics and quality healthcare. And we see to it that yes, we have to earn. Nobody says we shouldn't earn on the corporate. I would say the corporate should be beneficial and profitable, but to a certain limit, not to actually, as you rightly said, it shouldn't be a pain for the patients.
That's true. To
fill the bill. It should be comfortable for them as well as us. So let's not be so greedy upon,
make it a
pinching our money from them who are actually at the moment, they're in the need of the hour. So I think the hospitals should take care of it.
Wonderful conversation speaking to you, Dr. Preethi Reddy. And I'm sure that as we close this conversation and as we move in, I'm sure that when you manage your hospital, I'm sure that the kind of clarity of thought that you have, I think that is what must be helping in managing so many different facets of a hospital. Wonderful speaking to you.
Thank you.
I'm sure that wishing you all the luck.
Thank you so much.
Thank you very much for sparing your time
and speaking
to us at Hybiz.
Thank you. I would just say, sir, if you're passionate about anything, it may be, whether it is business or whether it is administration or whether it is politics, you need to actually play the role for what you've been, assigned for.
True.
Your idea should be very clear for what you are there in. Say for example, you're in politics. You're there in politics to serve the people, and that's it. If you want to get into politics with that agenda, or else do not get in.
So do it 100%.
Do it 100%. If you're into business, okay, complete your business aspirations, complete your goals, milestones, whatever you want to achieve. And once you're into a political game or you are into politics, you are here, you have been voted by the, by the citizens, and they need you. They need you, and you need them too. And if you are there, you stand by them when they need you, everything falls in place, is what I feel. And most importantly, sir, one more thing I would like to talk is about recently, you can add this wherever you can.
No, carry on.
In education system, I think we, Mallareddy Vishwavidyapeeth, we are the first to begin a school of digital health sciences and technology. Okay. So this is the need of the hour, as I said, that technology is everywhere. Whether a post MBBS person who has only he's been exposed to only medical sciences and he's trained only in medical system, he doesn't know much about technology. So as we now see that AI is entering into healthcare, even the MBBS students or the BDS students or post BMS or BHMS or whoever, pharmacy, they have to have an exposure to the technical background too, so that they are ready for the future generation, right? So this digital health sciences is not only for the MBBS but also for the technological people who are interested to come into healthcare. So it's a proper integrated course where health and technology come together. So we have started this school, and why I would say that we are one of its kind and it's unique because there are digital sciences, digital health courses even outside, but they are usually short. Okay. They are almost 6 months or 1 year. But this is a proper BSc digital health and MSc in digital health. It's a proper degree. And after this, you can do your masters, you can do your PhDs, you can also go abroad. You will be valued there because this education, this degree has a value outside. Whereas usually the certificate course, the certified course, usually they don't have a value outside our country. So, and most importantly, it's unique because we have the entire ecosystem in our in the campus, like we have medical, we have dental, we have pharmacy, we have nursing, we have technology. So all the basic sciences of all these domains are available in one campus. And secondly, the healthcare system. we have also the hospitals too. So the theoretical part and the practical part, the both are covered in this one
It's like
campus.
it's like a live laboratory.
Exactly, it's a live laboratory, and most importantly, you can choose whatever you can, and the whole system of education is as the UGC demands and the NEP 2020 asks for, is the multiple exit and the multiple entry and the multiple exit system, and also the choice-based credit system, the academic bank credits, the blended learning, the flipped class learning. It's talking about utilizing technology even in education.
True.
Right. So this all in this Mallareddy Vishwavidyapeeth we have started doing all this, and this is the need of the hour. What I see, most importantly, dual courses. We can do two BSc courses simultaneously. Okay, so this is all initiated by UGC, and we feel proud that we have implemented it, and we want the students should understand this new generation education. And yes, I would always say that we are always upgrading ourselves daily, and also we want to be the institution of today's generation.
Wonderful.
Not just today's, even tomorrow's generation, I would say. So this is one of its kind university where so everybody is welcome.
I think that message for the students is there's life beyond MBBS,
yes,
life beyond NEET.
Yes.
There's a lot of other things that they can do. Wonderful speaking to you and sparing your time and speaking to us.
Thank you.
Dr. Preethi Reddy, and we can go on and on, but there is a factor of time.
No, and I feel excited when a person like you interviews me, and you're such a experienced person. You must have taken so many interviews, and I think I can share my opinion with you.
Wonderful.
This is a platform where we can talk that what is the need of the hour, especially in education, healthcare system. And thank you so much. I thank Hybiz to give me to take an interview, and I was equally excited, and I'm so glad that I attended this. And
thank you very much.
And I'm here, yes. Thank you so much.
Ladies and gentlemen, that was Dr. Preethi Reddy, Vice Chairman or Chairperson, you can say,
of
the Mallareddy Vishwavidyapeeth, and of course a host of other institutions that she handles. What she spoke about from her heart is what she is doing and what she proposes to do. And I think who is watching, students, parents or others, should understand how the world of medicine is evolving, and there is a message in it. Thank you for watching. Jai Hind.